my name is Caitlin Pollack, and I'm here to compare healthcare between Germany and the United States for HRS 4370. We'll begin by comparing the healthcare systems. Germany has a universal multi-payer system that covers all legal residents, and it's funded through employees and employers that pay approximately 8% of their gross income towards a sickness fund or a nonprofit insurance company. Based on someone's income depends on the rate of the premium that they pay, so one smaller income means a smaller premium. The government has very little influence or control over the healthcare system. It's divided into a public and a private sector. About 85% of the population utilizes the public sector, and a majority of providers treat patients with public insurance. However, some do opt to purchase a supplemental private insurance plan, mostly by the wealthy, and there are some providers in Germany that only treat those with private insurance. The public system even covers medical modalities such as homeopathic medicine or holistic medicine, which is really unique. Many providers, however, feel undervalued because they have comparatively low salaries, especially compared to the United States. However, overall healthcare outcomes as well as patient satisfaction remains high. Comparing to the United States has a non-universal hybrid system that also has a combination between a public and a private sector. The U.S. spends upwards of $10,000 per capita on healthcare spending, which is more than any other industrialized nation in the world. The employers and employees pay premiums, which helps to fund healthcare insurance, as well as tax dollars. And the scope of coverage with patients who have private insurance isn't universal, so it depends on the plans that your employer chooses to purchase. There are two sectors to the public insurance, Medicare and Medicaid. Medicare services those who are 65 years or older and is universal across all 50 states. However, Medicaid is funded by state and federal governments, and it does vary by state to state. So Medicaid is not a universal coverage, and it caters towards those of low income as well as several other stipulations such as chronic renal failure. The Affordable Care Act, enacted in 2010, worked to reduce uninsurance rates. However, those who do not have insurance are forced to pay for their medical services out of pocket, whereas Germany has very affordable copays. Continuing on, we will cover infant mortality rates. Germany has a relatively low infant mortality rate of 340 deaths per 100,000 live births. Contributing factors to the relatively low infant mortality rate is universal healthcare coverage, considerably good prenatal care, as well as pregnant women do not have to pay copays when they go to the doctor. However, when infant mortality does occur, causes of this can include premature birth, low birth rate, as well as birth defects. In the United States, however, we have a comparatively high infant mortality rate of 580 deaths per 100,000 live births. There's contributing factors that contribute to this, such as lack of universal health care. A majority of U.S. pregnancies are unplanned, meaning women are not getting the prenatal care that they need at adequate times in their pregnancies. In addition to this, there are racial and ethnic disparities in infant mortality rates, with non-Hispanic Black ethnicities being the highest rate of infant mortality. In addition to this, there are poor education on proper safety of sleeping for babies, including the ABCs of sleep. When infant mortality does occur, causes of this can include sudden infant death syndrome, maternal use of drugs and alcohol during pregnancy, low birth weight, and premature birth. Continuing on to total healthcare spending per capita, Germany spends approximately $5,728 per capita on healthcare spending, which is considerably low comparing to the United States spending $10,224 per capita, which is more than double what Germany spends. Germany, again, just spends over half of what the United States spends, and the German average life expectancy is 79.8 years. In comparison, the United States healthcare spending is skyrocketing at an unattainable rate, to the point where in future years it risks putting the country's economic strength at jeopardy. In addition, the United States has a life expectancy of 77.8 years, which is considerably lower than Germany. Proceeding on, this graphic shows, again, the United States spending $10,224, more than any other industrialized nation on the board, whereas Germany comes in third at $5,728. Proceeding onwards, we're going to cover influenza vaccination rates. In Germany, there's a population of approximately 81 million. Comparing this, the United States has a population of approximately 325.7 million. In Germany, the World Health Organization has a goal for the entire European Union to have a vaccination rate of 75%. However, in the influenza season of 2017-2018, there were only 50% of Germans who were immunized. The The Germans only strongly recommend vaccinating those who are 60 years or older, which is considerably different than what the United States recommends. Comparing to the United States in the 2017-2018 flu season, only 48.6% of the population were vaccinated, and the CDC has a national goal for the United States of a 70% vaccination rate. Continuing on, this graphic again shows the vaccination rates across the country, where the dark blue states have the highest and most consistent rates of vaccination, whereas the lighter blue and white states have the lowest rates of vaccination or the lowest rates of reporting vaccination. Speaking about youth marijuana rates, Germany has approximately 3.1 million adult marijuana users, with 7% of those being between the ages of 12 and 17 and 15% being between the ages of 18 and 25. Marijuana use is on the rise among German youth, however the use of tobacco and alcohol have been decreasing. Officials warn that early use of tobacco may lead to several health concerns, including congenital defects, anxiety, heart and lung disease, and there have been national policies that have been proposed among the German government to prevent early and strong use of marijuana among youth. Comparing to the United States has 55 million adult marijuana users. There are almost as many marijuana users as there are cigarette smokers in the country, which is really unique. 15.3% of those are between the ages 12 and 17, and 52.7% of adult marijuana users are between the ages of 18 and 25. 33 million marijuana users in the United States consider themselves to be heavy or regular users. 61% of Americans are in favor of legalization of marijuana, and 10 states have legalized the use of marijuana for recreational purposes. Continuing on to safe drinking water, German drinking water is among the safest in all of Europe, and it's considered one of the most heavily regulated food and beverages in the entire country. The primary contaminants, when there are present, are chromium and nitrates. In comparison to the United States, only about 85% of the United States drinking water is considered safe, and 15% of U.S. drinking water is considered contaminated to hazardous levels. Those living in rural areas are at highest risk because they drink from well water, which is more easily contaminated. The most popular of these instances, however not in rural area, would be in Flint, Michigan, as they utilize an aging plumbing system that has lead-lined pipes. The lead is seeping into the drinking water and causing health concerns for people of all ages. Again, this graphic illustrates the places, especially in the home, that lead can get into one's water, which is centered around the plumbing system. Proceeding onward to the rate of uninsured adults. Germany, all residents are legally required to have coverage as long as they're legal residents of Germany. 85% utilize the public insurance system, whereas 15% purchased the supplemental private insurance plan, again, mostly utilized by the wealthy. The healthcare system is primarily financed through premiums and contributing tax dollars of that sickness fund. Comparatively, the United States has 12.2% uninsurance rates, which is approximately 28.5 million Americans lack health insurance, which is a huge number. The Affordable Care Act reduced the uninsurance rates from 2014 to 2017. However, the repeal of the individual mandate in 2017 showed an increase of uninsurance rates because insurance was no longer mandatory to purchase. Teen birth rates. Germany has a teen birth rate of approximately 700 per 100,000 live births. Teen pregnancies are more common in Eastern Germany than Western Germany, and this is because Eastern Germany displays a higher rate of unemployment. Teen birth rates are associated with low education levels as well as living in poverty. And contraceptives are available to all teens 14 or older, but they must be prescribed by a physician. Comparatively, the United States has a teen birth rate of 1,880 births per 100,000 live births. Hispanic teens have the highest teen birth rate, and teen birth rates in the United States are also associated with low education levels and low income levels. Contraceptives are available to teens, but they must be prescribed by a physician, and you must be 15 or older to purchase the emergency contraceptive pill. In conclusion, Germany has a much smaller population than America at 81 million versus 325 million. In terms of life expectancy, they do have a significantly higher life expectancy of 79.8 years versus 77.9 years. Germany has universal health coverage for all with relatively high health outcomes, whereas the United States does not have universal health coverage for all. Their healthcare spending is skyrocketing and health outcomes are relatively poor. Germany, however, has growing issues with increasing youth marijuana rates, whereas the United States has consistently advocated for legalization of marijuana, and 10 states have legalized that for recreational use. Germany has among the safest drinking water